World Health Organization says he, quote, understands why some countries, including Canada, reintroduced travel restrictions amid surging COVID-19 cases in China. Jason Gaidola joins us live tonight with more. Jason?
That's right, Phil. Canada's temporary travel measure takes effect tomorrow, and it will require travelers from China and neighboring countries to provide proof of a negative COVID-19 test. Now, the move was slammed by doctors here, but the WHO says that they do understand the move after they believe that there isn't enough reliable data coming in from China, and they say data remains essential when assessing the global picture. While fever clinics and morgues remain busy in China, much of the Western world is gearing up to require air travelers from there, including Canadians, to provide proof of a negative COVID-19 test. Starting tomorrow and for the next 30 days in Canada, all air travelers aged 2 and up arriving from China, Hong Kong, and Macau will need a COVID-free test taken no more than 2 days prior to flying. Other countries are taking similar action, and the World Health Organization says the measures are reasonable.
With circulation in China so high and comprehensive data not forthcoming, as I said last week, it's understandable that some countries are taking steps they believe will protect their own citizens.
WHO officials say the UN Health Agency is, quote, concerned about the risk to life in China. And one reason given was the lack of COVID-19 data on hospitalizations, deaths, and spread.
We continue to ask China for more rapid, regular, reliable data.
While boasting some of the harshest COVID-19 rules in the past 3 years, officials from China criticized the imposed testing and threatened countermeasures against countries involved. On the local front, many medical experts called the travel move unnecessary and political.
So obviously we are not doing politics, but maybe it's one way how they want to pressure China to release more data if they have more data.
Among them was McMaster University's Director of Infectious Diseases, Dr. Dominic Mertz, who says a variant in the U.S. is more concerning. He adds there are better ways to gauge viral spread among travelers.
Then I think wastewater testing of airplanes would probably be the next step, and that could be done globally and not Canada specific, and would inform WHO to some extent of what might be happening within that country.
Ottawa says this month they'll be running pilot projects on testing wastewater at the Vancouver International Airport and Toronto Pearson's Airport as well. Now, more on that variant in the U.S. that the doctor was referring to. They say that it does have more growth advantage compared to other variants, but there's no data yet on the severity.